Hello, and welcome to the seventh and last Pharmacy 15. This week, we'll cover two types of theranostic adjunct medications and two anticoagulants primarily used for blood labeling. The two types of theranostic medications are amino acids and antiemetics. The coagulants are heparin and ECD. Let's explore the crucial amino acid premedication, specifically lysine and arginine, that protects patients' kidneys during peptide receptor radionuclide therapy with lutetium-177 dotatate, commonly known as Lutathera. Before discussing amino acids, let's review how Lutathera works. Lutathera seeks out and locks onto specific somatostatin receptors found on gastroenteropancreatic neuroendocrine tumor cells. Once bound, the tumor cells internalize the radioactive complex, where lutetium beta emissions create free radicals that destroy the cancer cells from within. But there's a catch. Lutathera doesn't just target tumor cells. It also accumulates in several healthy organs, with the kidneys being particularly vulnerable. Why? Because these organs naturally reabsorb radioactive peptides, potentially leading to harmful radiation exposure. Amino acids, specifically lysine and arginine, act like protective bouncers, blocking the kidney's reabsorption of Lutathera in the proximal tubules. The results are impressive. 44% of Lutathera exits the body within 5 hours. 58% is eliminated by 24 hours, and over 99% clears within 14 days. Most importantly, this amino acid strategy reduces kidney radiation exposure by an impressive 47%, significantly improving the therapy's safety profile. The pretreatment protocol begins with antiemetic medication given 30 minutes before starting the amino acid infusion. We then administer the amino acids 30 minutes before initiating Lutathera and continue the amino acids throughout the treatment. A solution of 25 grams each of lysine and arginine in 1 liter of normal saline is used. This specific combination works better than mixed amino acid solutions for protecting the kidneys and is generally well tolerated by patients. Lysine helps protect kidney function by quickly metabolizing and binding to potentially harmful molecules, helping to remove them through urination. Arginine supports kidney protection by improving blood flow and producing nitric oxide. These amino acids work well together because they share the same absorption pathway in the intestines. This shared pathway actually helps balance their absorption and reduces their side effects. For the infusion, we set up 2 separate IV lines, one for Lutathera and one for the amino acid solution. The amino acids start flowing 30 minutes before Lutathera and continue for 4 hours, with the infusion rate set between 250 and 500 ml per hour, depending on the total volume needed. While amino acids provide essential kidney protection during Lutathera therapy, their administration requires careful consideration. The hyperosmolar nature of these solutions draws water from the surrounding tissues, potentially irritating the gastric mucosa and triggering nausea and vomiting. Freshly compounded amino acid solutions offer several significant benefits, including improved patient tolerance, with only 9% experiencing emesis versus 50% with commercial preparations, absence of unnecessary preservatives and electrolytes, lower osmolality, reducing gastrointestinal side effects, enhanced effectiveness in preventing renal radioactivity uptake, and shorter duration of adverse effects when they do occur. Commercial preparations often lead to prolonged nausea and vomiting, sometimes lasting days and requiring additional antiemetic intervention. It's essential to note that high-dose lysine solutions of about 75 grams can induce serious metabolic disturbances, particularly hyperkalemia. This electrolyte imbalance carries the risk of potentially fatal cardiac arrhythmias, emphasizing the importance of using appropriate amino acid concentrations. Side effects include nausea, vomiting, abdominal pain, dizziness, headache, and flushing. Now let's move on and discuss antiemetics used during theranostic procedures such as Lutathera and Lu-177 Pluvicto. First, I'll discuss antiemetics in general, and then I'll specifically discuss Zofran and Amend since they're on the components of preparedness. Antiemetics are medications designed to prevent and treat nausea and vomiting, targeting multiple neurotransmitter pathways that control nausea and vomiting in both the central nervous system and gastrointestinal tract. The antiemetic response works by blocking signaling pathways in the brainstem's vomiting center. Who knew we had a vomiting center? And by interfering with neurotransmitter receptors, including histamine, dopamine, serotonin, acetylcholine, and neurokinin, and by inhibiting stimulation of the gastrointestinal tract, diaphragm, and abdominal muscles. Antiemetic medications work through several distinct mechanisms. Serotonin, or 5-HT3 antagonists, block receptors both centrally in the chemoreceptor trigger zone and peripherally on vagal nerves. Ondansetron, or Zofran, is a serotonin receptor blocker. Dopamine antagonists block D2 receptors in the chemoreceptor trigger zone. Antihistamines target H1 receptors in central areas. NK1 receptor antagonists block substance P. Aprepitant, or Amend, is an NK1 receptor blocker. And anticholinergics block muscarinic receptors. The choice of specific antiemetic depends on the underlying cause of nausea and vomiting, with some agents being more effective for particular indications. The medications can be administered through multiple routes, including oral, intravenous, and transdermal preparations to suit different clinical scenarios. To prevent treatment-related nausea and vomiting from amino acids, administer an intravenous bolus of antiemetic medication at least 30 minutes before starting the amino acid solution infusion. This timing ensures maximal antiemetic effectiveness. Recommended antiemetic options include ondansetron, or Zofran, which is most commonly used, and granisetron and tropisitron. Let's review the key aspects of Zofran administration for treatment-related nausea and vomiting. The recommended dose is 16 milligrams delivered through intravenous infusion over a 15-minute period. As I said, for optimal effectiveness, we administer this medication 30 minutes before starting the amino acid infusion, allowing it to reach peak antiemetic efficacy. Additional doses may be necessary, and 2 subsequent doses can be given at 4 to 8 hours. Contraindications include any history of hypersensitivity to Zofran and current use of apomorphine, a medication used for Parkinson's disease. Patients should be monitored for common side effects that include diarrhea, headache, and fever. Remember to document any adverse reactions and adjust subsequent dosing as needed based on the patient's response. Now let's review the essential information about Amend, or fosaprepitant. The initial dose consists of a 150 milligram, 50 ml vial administered through intravenous infusion over 30 minutes. This is followed by oral doses of 80 milligrams on days 2 and 3 of treatment. The medication's antiemetic effects begin within the first hour after administration, provide sustained protection for several days, and gradually decrease over time. Amend cannot be administered to patients with known hypersensitivity to the medication or current use of pulmazide therapy. Amend interacts with many medications, which will need to be looked up prior to administration. Patients should be monitored for general symptoms such as fatigue and weakness, gastrointestinal effects such as a loss of appetite, diarrhea, abdominal pain, or hiccups, cardiovascular changes including blood pressure fluctuations, and neurological symptoms such as headache. Remember to assess patients for these side effects throughout the treatment course and document any adverse reactions. Finally, let's discuss anticoagulants, including heparin and ACD, which are both used in blood labeling procedures. Anticoagulants are medications that prevent blood from clotting or stop existing clots from growing larger by interfering with the body's blood clotting process. However, anticoagulants do not break down existing clots. Let me outline the key aspects of both heparin and ACD solution. In nuclear medicine, heparin serves as a critical anticoagulant by forming a complex with antithrombin 3, a naturally occurring plasma protein. This interaction initiates a cascade of anticoagulant effects through three primary mechanisms. First, it accelerates the neutralization of activated coagulation factors. Second, it provides inhibition of both factor XA and thrombin. And third, it prevents the conversion of fibrinogen to fibrin, thereby inhibiting clot formation. In blood cell labeling procedure, heparin's anticoagulant properties are essential for preventing both clot formation and propagation. The specific dosage requirements vary according to institutional protocols and labeling techniques. For example, some facilities use pre-heparinized collection tubes, while others employ the direct addition of heparin to blood-containing syringes. It's imperative to note that the timing of heparin administration must be precisely controlled, as the compound demonstrates the capability to bind with radionuclides used in labeling procedures. Standard protocols typically specify a heparin concentration of 10 to 15 units per milliliter of whole blood for red blood cell labeling and 1,500 to 2,000 units for leukocyte labeling. Absolute contraindications for heparin administration include documented heparin sensitivity, acute bacterial endocarditis, and elevated bleeding risk. Additionally, careful clinical consideration must be given to patients with concurrent anticoagulation therapy, asthmatic conditions, hepatic dysfunction, and known animal protein allergies. Potential adverse effects include hemorrhage, bleeding complications, and hypersensitivity reactions. Furthermore, clinically significant drug interactions may occur with nonsteroidal anti-inflammatory agents and acetylsalicylic acid or aspirin. And finally, acid citrate dextrose solution, or ACD, contains citric acid, sodium citrate, and dextrose in water. It's mainly used as an anticoagulant in yellow top tubes to preserve blood specimens and prevent clots. It's sometimes preferred over heparin because it improves image quality due to less non-target activity. The citrate ions in ACD combine with calcium in the blood to prevent coagulation. The dose of ACD for blood labeling is 0.15 ml per ml of blood. Note, excess ACD can impair the diffusion of stannous ions across the red blood cell membrane when tagging red blood cells. ACD is what's in the syringe 2 in the UltraTac kit. ACD is not for direct intravenous injection or infusion. The adverse effects are related to citrate toxicity, and symptoms include paresthesia, tingling around the mouth, hypotension, and cardiac arrhythmias. All right, so there you have the seventh and final Pharmacy 15 on medications used as adjuncts in theranostic and blood labeling procedures. Let me summarize the key points we covered. Lysine and arginine are used in amino acid solutions to protect the kidneys during Lutathera therapy by blocking the reabsorption of radioactive peptides. A solution of 25 grams each of arginine and lysine in 1 liter of normal saline is administered, starting 30 minutes before Lutathera. Antiemetics like Zofran and Amend are used to prevent nausea and vomiting during theranostic procedures and are administered 30 minutes before the amino acid solution. The recommended dose of Zofran is 16 milligrams, delivered intravenous over 15 minutes, and the recommended dose of Amend is a 150 milligram, 50 ml vial administered intravenously over 30 minutes, followed by oral doses of 80 milligrams on days 2 and 3 in treatment. Heparin and acid citrate dextrose, or ACD, are used as anticoagulants in blood labeling procedures. The dose of heparin is 10 to 15 units per ml of blood, and the dose of amino is 0.15 ml per ml of blood. Thank you for joining me for this Pharmacy 15 series on adjunct and interventional medications used in nuclear medicine procedures. I hope these brief 15-minute-ish reviews have been helpful in your preparation for your board exams. Remember, summary documents for all of these topics are available on Moodle for your reference. These concise notes should serve as an excellent study guide as you review for your exams. As you continue your preparations, stay focused and confident. Your hard work and dedication throughout this program have prepared you well for the challenges ahead. I have full faith in your abilities and know you'll do your best. Wishing you all the success on your upcoming board exams. You've got this.